My name is James Fraser and I'm giving a talk tonight on the introduction to vibroacoustics. Vibroacoustics is a sound therapy. It was developed in Scandinavia in the 60s. It's very pure low frequency sine waves, so it's just very low frequency bass. It's the kind of bass that you can't hear but you can feel. So we're talking about 40 cycles per second, 40 hertz. So if you can appreciate, if you lie on a piece of furniture with speakers fitted to it and you play this low frequency through the furniture, then the vibrations are actually going to be imparted to the body of the person lying on the bed. And from about 30 odd years of research in Scandinavia and the States, they've found out that certain frequencies are really good for rejuvenating the human body. So the one I'll be using tonight is a 40 hertz file, 40 cycles per second, and what that's in charge of is regeneration of the body. Well, I first came across the therapy when I was working as a music tutor at Beaumont College, which is a college for people with disabilities. And a fella I met suggested that it might be particularly effective for people with cerebral palsy. So I did some reading on the subject. I've managed to get myself a vibroacoustic bed from America, and now I work as a vibroacoustic therapist for people with chronic illness and disability. There's other frequencies that you can use which are particularly good for respiratory ailments like chronic obstructive pulmonary disorder, muscular dystrophy. People trying to get mucus off the chest, or people with movement difficulties find them particularly useful. And there's a whole range of other frequencies that we've not even looked at which might be perfect for certain ailments. But the message is that basically just using sound, so there's no chemicals, there's no radiation, there's no electromagnetic stuff going on, just using sound, that it seems to have a real helping effect for people, particularly those people with chronic illness. It's very exciting. And tonight all I want to do is really just to raise awareness for people in the northwest of England. Basically there are no vibroacoustic therapists up here as far as I can tell, and there's very few in the UK, whereas in Scandinavia it's used in most treatment centres and hospitals. I'll be presenting some scientific research tonight that shows that for people with Parkinson's, for people with chronic obstructive pulmonary disorder, for prostate problems, for people with cerebral palsy and movement disorders, that it's really effective. And it's just a matter of time, I think, before this kind of therapy is more widely available in the UK. And obviously I'm one of the first people to be offering it, so really exciting. The background to this is that according to the King's Fund study, 25% of us have some kind of chronic illness or disability, so that's 15 million people in the UK. And a chronic illness or a long-term condition like that is categorised as something that doesn't have a cure. So people have been maintained in a state of ill health, and they're taking pharmaceuticals to combat the symptoms, and that's costing 7 out of 10 of every pound spent in the NHS budget. So surely something like this is worth a look. Become aware of the alternatives to conventional medicine. I think that there's going to be much more research done on this sort of area in the future. Come and try it out. It's quite nice.